I've been told by my friends.
That is a phrase I never want to hear. In this mock interview, you'll learn exactly what captures my attention as an interviewer, how to structure your answers to common questions like why do you want to go to school X? And stay until the end, because this pre-med closes the interview in a way I have never seen before. And truthfully, I think it's a bit controversial. Interviewer introduction. Most pre-meds mistake when the interview starts. They think that it starts when the interviewer asks them, tell me about yourself, but you're already late. If the school sent you who is interviewing you, that's the moment that the interview starts. If they don't, then the interview starts when the interviewer introduces themselves. There's so much information there that most pre-meds ignore. Listen to me introduce myself and see what you can pick up on.
Hey, Rian. I'm Dr. Lee.
But you can call me Mike. Stop worrying about if you'll get into medical school. Become competitive enough to start deciding where you go to medical school. If you want to be a doctor, you can't make red flag mistakes on your interview or on your application. So to avoid that, read real applications from real students who earned real acceptances to schools like UCSF, UC San Diego, and UCLA, where I trained. And every time we review a new application, like this student who earned a full ride scholarship to Kaiser, we add it to the application database. So you have the most fresh, most brand new applications to know exactly what is working right now. Over 11,400 pre-meds are in our community, and we'd love it if you join too. Click the application breakdown link in our description box below now.
Hey, Rian. I'm Dr. Lee. You can call me Mike. I am one of the anesthesiologists here at Georgetown. I've been working here for about 15 years and have been a part of the admissions committee for the last 5 years. I do a lot of education research here. So I work with a lot of the medical students on physiology-based stuff, and then a lot of the residents with simulation-based stuff outside of like my clinical care. I was born and raised in Los Angeles. I went to school at UCLA. I went to med school at UCLA. And then I came out here in the East Coast for training.
So I tell you a lot here. For one, I'm a seasoned anesthesiologist. My extra clinical focus is on education research, specifically simulation. I was born and raised in Los Angeles and practically did all of my training at UCLA. And this is totally relevant for this interviewer who did most of her training in Southern California. The takeaway here is to write those notes down. Keep a mental note. And where it's relevant during the interview, reference back to those things. From an interviewer's perspective, we've been learning about and asking about other people all day. And so it's nice to be heard. And it's nice for someone to be interested in us and in our journey. It signals to me that you're being present and that you're listening to what I have to say. Tell me about yourself.
My name is and I recently graduated college. So I was born and I'm an only child, but growing up, I never really felt like it because I always lived with my grandparents or my cousins. My parents were always like my parents, but my grandfather is the person who I really consider to be one of my first friends in my life. He introduced me to some of the hobbies that I still continue to this day and throughout college, like swimming and cooking for my friends and family. And it was also through my grandfather that I was first exposed to medicine. So English isn't my family's first language, and this was always the most apparent in the hospital setting. And when my grandfather was diagnosed with lung cancer, it was seeing this exposure to kind of the cultural and language barriers he faced as an immigrant in the American healthcare system that kind of sparked my interest in pursuing medicine.
The secret strategy here is to remember that they are interviewing you because they're seriously considering you. Feels like pre-meds think that a great interview is based on how many topics you can hit and how many buzzwords you can throw out there like it's a high score in a video game. That is wrong. Focus there and you'll notice that you can't get through all 15 of your extracurriculars. In fact, you may barely get through 5. Just getting through all 15 is not the goal. So this tell me about yourself is really nice. We start with kind of where the person is from and how her grandfather was one of her closest friends. But then things kind of speed up really quickly, right? We go from grandpa teaching us swimming, and then grandpa is sick, and then now grandpa makes me want to be a doctor. And the reason I think it feels very abrupt is that there's not a lot of detail or specific examples that signal to the interviewer exactly what she means. She shares that there's this exposure to cultural and language barriers as an immigrant. But I don't really know what that means. I myself am not an Indian grandfather, so I think it is your role as a pre-med to explain exactly what you mean and how those experiences got you to medicine. But remember, that's not the actual question. The question was just tell me about yourself. So while you necessarily don't have to answer the question, why do you want to be a doctor? You can, but you can kind of see how we're starting to go from swimming to lung cancer, and now we're kind of all over the place.
Even as my family moved out to here where I am now, I continued my interest in medicine through hospital volunteering and cancer research. And in high school, I was super lucky to receive a scholarship to attend. And while I was attending, I learned a lot about healthcare policy advocacy, and I was a Spanish medical interpreter to help immigrant populations similar to my grandfather. And after my time at I'm now in my gap year, and I'm in again, and I'm doing research on a pediatric cancer called medulloblastoma, which has disproportionately high incidence rates in rural. And on the weekends, I am also a server at a brunch spot called.
Remember that the role of tell me about yourself is to summarize your journey. And most importantly, it's to give the interviewer a couple of springboards to hop off from. The secret strategy here is to shape your answer, to guide, to coax your interviewer into talking about what you want to talk about. For example, I would not talk at all about hospital volunteering in my tell me about yourself because I hated talking about it. I would talk about my community health work with Vietnamese and Hispanic immigrants because that's where I'm strong. I would bring up my coaching intramural basketball. This opening tell me about yourself answer shapes the interviewer's initial impressions. And you want to play with home court advantage to show them where you're strongest. One thing that many pre-meds don't talk about is the benefit of just having more interviews. Yes, it's obvious that you get more chances to become a doctor, but also you get to practice in more real interviews. There's something about that game day pressure of a real interview that you cannot replicate with a mock interview. And of course, to get more interviews, you need a really dang strong application. My life as a pre-med changed when I understood how to write a strong medical school application. Tens of thousands of pre-meds every year make critical mistakes during the process. If you want to maximize your odds into getting into as many medical schools as possible, schools like Mayo, WashU, full tuition places like Einstein or Kaiser, then you'll need to write the best application that you can. And we at Pre-Med Catalyst can help. If you're finding this mock interview helpful, imagine how helpful you'll find working with us directly. This cycle, we're working with 16 students, and those 16 students already have 65 interviews, and it's just December. Click the mentorship link in our description box below now. Interviewer back and forth. One of the biggest misunderstandings that pre-meds have about interviews is that it is a one-way street. That's not true. You're also interviewing them. Remember that they are interviewing you because they're seriously considering you. And remember that many students they interview have multiple interviews and will ultimately choose from different acceptances. And so it's actually their job to put the best version of their school out there so that you feel like you also want to go there. Interview with that in mind, even if you don't necessarily have many interviews. There are two reasons this is important. First, the pressure isn't all in your court when you start to realize that you're interviewing them. They also need to make an impression. So don't feel like you're backed into a corner and that this is your only option. And second, when you interview with this mindset, you can start transforming this one-way interview into a two-way conversation where you're learning about them and they're learning about you. Take a look again at the end of her tell me about yourself.
And I'm doing research on a pediatric cancer called medulloblastoma, which has disproportionately high incidence rates in rural Nebraska.
First and foremost, very cool that you're doing research on medulloblastoma from the anesthesiologist point of view.
Truthfully, it's hard to recognize that these are windows into transforming your one-way interview to a two-way conversation. But when you train your ears for it, you start noticing it every single time. Here, I'm throwing her a bone by talking about medulloblastoma, the research that she does. Eventually, yes, at the end of that clip, I ask a question. But if you're the interviewee student, take a moment to acknowledge what I brought up before you go ahead and answer the question. Again, it just shows that you're listening. You don't necessarily have to ask a question about the anesthesiologist's perspective on medulloblastoma, but you should start throwing in these mentions that you're acknowledging and mirroring and hearing what the interviewer is saying. It starts warming up the interviewer with this back and forth. It's not this question, answer, question, answer, question, answer. It's question, answer, comment, reflect, comment, then question, answer, comment, ask question, answer question, back and forth, ping pong, ping pong, ping pong. When you start warming the interview up, this opens up the possibility of you asking the questions later in the interview. Then you're in the driver's seat and you can take the interview in any which direction. So do not pass these opportunities up. If you have an interview you need to prep for, let me know. I can help. My email is michael@premedcatalyst.com. Your answers suck if they don't have. Many premeds repeat these same exact mistakes that they do on the personal statement. There is no specific details. Take a look here.
And when my grandfather was diagnosed with lung cancer, it was seeing this exposure to like kind of the cultural and language barriers he faced as an immigrant in the American healthcare system that kind of sparked my interest in pursuing medicine.
Again, this feels very broad, doesn't it? I don't know exactly what cultural or language barriers that immigrants, Indian grandparents experience, because I am not an Indian grandparent, nor do I have Indian grandparents in my family. And so naturally, I ask for more detail. I give the student an opportunity to expand, and this is what she does.
You mentioned a little bit about your grandfather's lung cancer and the cultural and language barriers. I'd like to just learn a little bit more about that. What did you mean by all of that?
He obviously knew little to no English, and both my parents and me and even like the healthcare team, we tried our best to like help him break down like the complex jargon to understand what's like non-small cell lung cancer, what it means, and then also my parents did a lot of like, translating work for him in the hospital, like breaking more complex things down into simple terms.
It's still bland, non-specific. She throws in some buzzwords like jargon or non-small cell lung cancer. That still really isn't specific enough. Those aren't the details we're looking for until she does this.
He had a lot of like nausea and things like that, low appetite, and it was some members of the healthcare team that even like helped him find like foods that are more like palatable to his food palate as like an immigrant, and not have to eat some of like the quote unquote bland like hospital food that over there.
And there it is, a specific instance where his culture overlapped with his healthcare. And you know exactly when you've hit the right level of specificity when your interviewer can resonate with what you're saying. And take a look at the understanding that I show and the resonance that I feel towards that example here.
Yeah, I mean, I'm Vietnamese, and I can't imagine my mother, if she ever, hopefully never gets sick and stays in a hospital, I can't imagine her ever eating like a hamburger from the
yeah, for sure.
Too many times it feels like premeds think that a great interview is based on how many topics you can hit and how many buzzwords you can throw out there like it's a high score in a video game. That is wrong. The best interviews are memorable because of the specific stories and the details of your impact that you can leave your interviewer with. Focus there, and you'll notice that you can't get through all 15 of your extracurriculars. In fact, you may barely get through 5. And that's okay, because those are your strongest 5 extracurriculars. Getting through all 15 is not the goal. The goal is to leave a memorable impression, and you do that with a host of impressive, detailed stories. Why medicine? I guarantee you will get this question.
Help me understand why you decided to apply to medical school. Why do you want to be a doctor?
I think being a physician is really unique in that you get to have like the depth and breadth of knowledge to be able to create like a comprehensive like patient care plan. Also, I feel like as a physician, especially in some specialties, you have the opportunity to create a lot of longitudinal patient like relationships like over time. So I guess like one of the experiences or seeing like a physician like be a physician that showed me that I wanted to be like them someday was when I was a Spanish medical interpreter. One time at an appointment, one of the doctors had to break some bad news to one of our patients. I think one of our patients it was a female patient, and I think she needed to get a hysterectomy for, I can't remember like what reason, but that needed to happen. And it definitely took like an emotional toll on her hearing that news, because I guess like that was a scary experience to hear that needs to be happened. And the physician explained that to her gracefully. This was not like a Spanish speaking patient, and I was just being an assistant in the room, but definitely took a big toll on her. And I saw how the physician handled it, and it was after she had wrapped up her appointment that she kind of explained how the process goes for breaking bad news to a patient. So what you want to do is you always want to be like eye level and sitting eye to eye with them, and you always want to ask them, oh, do you want to talk about treatment plans, or do you want to talk about what this diagnosis means, lifestyle changes, kind of helping the patient drive which way the conversation goes to help them feel like they have like control. And you should never say things like it happened for a reason, because obviously things don't happen for a reason. But if a patient is very like spiritually guided and they say, I guess this was like my destiny, there's nothing wrong in like affirming that for him. And I guess that was really impactful for me, because I feel like I've had a lot of difficulty kind of navigating like difficult relationships and difficult conversations, because my parents kind of grew up under censorship, and my mom always like kind of had this habit of like avoiding difficult conversations. And I feel like I absorbed that habit of avoiding difficult conversations, but seeing a physician do that so gracefully and understanding the nuances of having difficult conversations really inspired me that it's an important field that needs to be in society.
So we had 3 threads there: breadth and depth of knowledge, longitudinal patient experiences, and this ability to have difficult conversations. And what I love and hate about this answer is the exact same thing. Maybe you noticed that the first 2 points weren't really rooted in anything. I could have asked ChatGPT, why do people want to be doctors? And those things would have come up. In fact, any pre-med could have said that, and I would have just nodded my head along. And what I love about that 3rd thread is that it's rooted in a real situation. There, she sees her physician be a real role model. But what I don't love is that she wasn't really involved in that situation. It's a one-time conversation, and we know that becoming a doctor is a huge commitment, 8 to 12 years of schooling. It's not just this one switch that turns on because you had one moment in time. And remember, she has 3 most meaningful experiences, 12 other extracurriculars, an entire personal statement, and secondaries to go off of. So when you get to the interview and this is all you can share, it comes to question, what happened to all the rest of the stuff that you wrote about on your application? I brought you to the interview because of what I liked on your application, so do not go away from that. Your why medicine answer must be deeply personal, and it must be extremely specific and unique to your own story. And so if you're choosing to answer this question with broad things about medicine, or you're just highlighting instances where you're not really involved, it's hard for me, the interviewer, to understand, oh, that's why this student wanted to become a doctor. What is Georgetown's mission?
Georgetown's mission, I know that they really care about one of their tenets called Cura Personalis.
Just for anyone who is not familiar with Georgetown's mission statement, Cura Personalis is a Latin phrase that means caring for the whole person.
I guess one of like an experience that like comes to mind that was kind of embodies like Cura Personalis and how like I've applied it to my life was also from when I was a Spanish medical interpreter in the clinic. We had this was a very like short interaction, but we had a mother and a son come in, and in every appointment there's like 2 interpreters on hand, and there's like a senior interpreter and there was me. And they had come in the past, and the senior interpreter had told me that the mother was Spanish speaking, but the son knew English but was deaf. But the senior interpreter knew American Sign Language. And in like the 20 to 30 minutes before the appointment, I was like, oh, like, can you show me how to just introduce myself? I obviously can't help immensely, but I didn't want to just like not acknowledge and not include her son in like the appointment and just like stand there. So I in those 30 minutes I learned how to sign like hello and like a small introduction to her son. And I guess care personalis is about assisting to the unique needs of people, both spiritually, mentally, physically, based on who they are as a person. And I was able to help both a language barrier in like 2 different senses almost. So that was very fun and unique experience that showed me that I want to incorporate cura personalis into my practice.
I love this answer a lot. For one, it's easy to remember. We have this son who is deaf and can't really communicate with most of the outside world. But of course, he is just as deserving as anyone else to be involved with his or his family's health. So not only does our student demonstrate understanding of that person's relationship to the world, she demonstrates whole care for the mother, who only speaks Spanish, and for the son, who is deaf. The key to answering questions on an interview is to have a box of stories that you are prepared to tell. And when you get a question that gives you the opportunity to showcase one of these stories you've prepared, because it will be those telling stories that your interviewers remember. Because it will be those telling stories that your interviewers remember. It will be those stories that they resonate with and can use to advocate for you when they go back to the interview admissions committee. Why Georgetown?
Why do you want to go to Georgetown? Why not stay in California, sunny California? Why not stay home with the folks in Nebraska? Why Georgetown? Kind of far from both those places.
When I think about why I want to attend Georgetown as an institution, there's kind of 3 main reasons that guide.
I personally think that this structure is genius. It signals to the interviewer that there are 3 main reasons that they have to pay attention to. It structures the answer so you can remember it easily. And so the interviewer can also easily remember it when they're taking notes or when they're advocating for you during the admissions AdCom meeting.
One of them being that Georgetown has a longitudinal track called the Healthcare Justice Alliance track. And it's kind of a specialized curriculum for students who are interested in healthcare policy advocacy and medical legal partnerships. And in my time at college, I've had some exposures to how to advocate for better healthcare policy. So I was involved in a nonprofit called the American Lung Cancer Screening Initiative, called ALSI for short. And what we would do is we would help get people connected to screening centers through canvassing, but we would also try to connect with House of Representative members in the area to advocate for bills that help lung cancers, that advocate for lung cancer screening. So I know if like every physician knows this, but like to get your lung cancer screening covered by insurance, you have to meet like some very strict guidelines, and some of them be like you have to be a smoker, have to be within a certain like older age, and these guidelines don't encompass like the true at-risk population. Some of the physicians who work in ALSI like had worked and figured this out, and they had proposed this bill called Catherine's Law, which basically puts the power back in the hands of physicians to make the judgment of when a patient can be referred to screening and have it be covered by insurance. And they basically proposed this bill. And it was up to me to kind of reach out to some of the House of Representative members near the Southern California area and basically present my presentation and be like, if you could sponsor this bill or bring it to incorporate it into when you go to Congress, that would be like amazing. And so basically I got to see how you can advocate and get connected to help healthcare policy make an impact on a large much greater scale. And this track will kind of help me know how to be a physician and kind of find the gaps in healthcare, make a strategy, and build like bills and legislations to kind of help that, help issues in healthcare. So they have, I think it's a class called the advocacy elective, and I think that specifically teaches you how to model legislation and what its effects would be. And I got off a very, like small slice of, healthcare advocacy in my undergraduate career, but I'd love to know how to tackle it from start to finish. And Georgetown can uniquely do that through the healthcare advocacy, health justice alliance track.
Can't you just appreciate how fantastically specific this is? You pair a literal advocacy class at Georgetown with an extracurricular campaign where you push forward a bill to open up accessibility for lung cancer screening. Anyone can start to see that that is a match made in heaven. Take a look at the second part of this answer too.
Another reason I think DC is unique because it kind of has the amalgamation of all of kind of like the healthcare accessibility and healthcare issues that I've seen from growing up and living in many different places. So that's why I think DC is this place that could uniquely interests me. In Nebraska, we have one main university system that's located in Omaha and one smaller one in Lincoln, and they're both kind of situated right in one corner. So we have a lot of farmers and rural populations having to travel hundreds of miles to access proper care that they need. And growing up and seeing that through my hospital volunteering experiences and also accessibility issues in LA, seeing how those are also present in DC, because I have family friends in DC, and things such as the healthcare disparities in Ward 7 and 8 are very different from the healthcare disparities in places like Ward 2 and 3, which are closer to the capital and the more affluent areas.
You get this real argument that training at Georgetown would equip her with the skills to go back to her own community and really serve them better. By purposefully drawing these bridges, by using specific examples from your lived experiences and how those can enhance their program, you start to really make the case naturally that you'd be a perfect fit there. Tell me about a time when.
Are there any other extracurriculars that you kind of wanted to just highlight, maybe one or two that you want to share?
I was a community organizing intern at a nonprofit called SAGE. It stands for Strategic Actions for a Just Economy. And their whole mission is to help the housing crisis and empower the tenants in the more in South Central LA, which a lot of people financially struggle there, help them with the housing crisis. So they have a lot of separate projects, but I was specifically involved with this Right to Counsel project. And we helped, we did a lot of cold door knocking and canvassing work in South Central LA. So what we would do is that we would kind of map out the places where a lot of people are facing eviction or need rental assistance, and we would connect them to free rental assistance programs that are also in LA, or free legal aid if they are facing eviction. And obviously we would, show up in these shirts with our logos and kind of clipboards. We kind of look, like overbearing solicitors at times. So it kind of taught me a lot how to connect with people who randomly approach you in the street and, try to say I'm not trying to sell anything. I'm trying to help you, and I'm trying to help a serious issue that's happening in your environment. A lot of people in South Central LA are undocumented or are economically disadvantaged. So it kind of taught me a lot how to make some genuine connections with people and help people get connected to legal, financial, or even healthcare aid that they need throughout the community.
Nice. I'm very curious. I think the phrase overbearing solicitors is kind of a funny one.
So you can see here that I actually respond very positively to that phrase. I remembered it in spite of all the other things that she said. Many interviewers will not be as explicit as I am in telling you what was funny or what was interesting or what I want to know more about. But most interviewers will tell you even if it's in a subtle way, what they are interested in and what they are not interested in. It might be what they laugh at, or it might be what they ask questions about, or it might be certain things that they start leaning into and really getting engaged and present. Take the hint. That is your interviewer giving you crucial information.
So we would quite literally just, drive around, park somewhere, and then go door to door with our clipboards. And our kind of like director of the project said, like canvassing is very hard because people, they're usually busy or working and they don't want to give you your time of the day usually. So what he told us was that, you shouldn't start off with like loaded questions like, are you struggling with rent, or are you doing with this? For example, one time I knocked on a lady's door and her cat came immediately. And my family also has a cat, a black and white little tuxedo cat, and hers was also a tuxedo cat. So I was like, oh my God, your cat looks just like mine back at home, kind of sparked a conversation about a shared interest. And after that ball kind of got rolling, we kind of told this woman about what we offer, and she even decided to join our focus group at Sage. And also with people who even didn't want to like take like a few seconds to like speak with us, what we would do is that what we learned actually is that you shouldn't like ask, can you just have one more minute? Can I just have 2 more minutes? Because that's kind of doubling down and adding some pressure on them, and that makes them more resistant to like even give you like another chance or listen to what you're saying. So we kind of like had this perspective first, like we should just like 20 more seconds, something like that. But that wasn't working. It was making people more resistant to take even like a second to speak with us. So what we actually did is that we were like, no problem at all. And then we would just come around like another day, just knock on the same door another day and be like, hey, like maybe it wasn't a convenient time. We also noticed that there's certain times of the day that people are less like in tune to like take some time to interact with us. Some of them being like the lunch hour or like 4 or 5 p.m. So we just came back and maybe like the morning time or at a more convenient time, because kind of doubling down and asking for like more time puts pressure on them and makes them less resistant to trust you.
These stories are the definition of show, not tell. She shares how she's learned not to open with pressuring questions. That shows me that she's grown to be more considerate and more understanding of people. She shares how she lets the conversation go and is always happy to come back at a better time. And that detail shows me that she really does do this. She clearly knows what she's doing, and even if it's embarrassing and hits her ego, she believes that the mission is worthwhile. That is the type of person we want at our medical school. And we get to that conclusion because we focus on the strength of the story. What do you think might be the biggest issue facing healthcare today?
I obviously haven't had exposure to everything that there is to know about healthcare, but from my personal experiences, I think that there is definitely like a lot of just lack of trust in some like healthcare, in our ability to provide healthcare from the patient side, and helping them feel like more comfortable in sharing and asking questions. So as a medical interpreter, a phrase or like a modifier that I would hear a lot in my work was like "tengo una pregunta tonta," which kind of translates to "I have a dumb question" or "I have a silly question." And the thing is like obviously in healthcare there's no such thing as like a dumb question or like a silly question. And I would hear that phrase like very often, and it kind of like shows how patients might not feel like they're in an environment that their questions might get laughed at, or not be like they couldn't feel comfortable sharing like even like questions that don't seem like logical. And that's I guess rooted in a lack of trust in like, yes, we're providing a service, but we're also a partnership with them and their healthcare. So
it's these small details that humans notice and can resonate with. If you've been in healthcare, you know that patients do this all the time. They hedge because they feel this power dynamic. They don't want to be embarrassed. And so they open up with, "I have this really silly or really dumb question." And when you practice telling your stories, you want to find these moments that other people will nod along with or smile or resonate with. Even if people don't remember the exact detail, they will still remember how they felt. And in fact, you can see me in the corner of the screen nodding and smiling along with her answer. And that's because I am remembering my own patients asking me that exact same question. This was a fantastic approach to the question. And remember, there are many ways to answer what is the biggest issue in healthcare. What matters is how you support your answer and what evidence you have to back it up. Why should we choose to accept you?
So I think like a few of my qualities that...
A quick interjection here for these questions. I think it actually helps you to start by uplifting other applicants first. When you recognize that there are a ton of deserving pre-meds that also deserve to be doctors and it would be a perfect fit at Georgetown as well, that just gives you a sense of true, genuine humility. It's certainly optional, but this is what I would start with. And then you can get to making your case as to why you ultimately do deserve that seat.
So I think like a few of my qualities that make me a great fit for Georgetown and just a fit to be like a physician in your guys' institution would be I've been told by my friends that I'm a very open-minded person.
Nope, stopping you right there. That is a phrase I never want to hear. When you say, I've been told by my friends, it almost feels like we're shirking responsibility or we're putting on this false facade that we can hide behind. If you feel like you're truly open-minded, then show me with a real story or own up to it and tell me and then support it. In fact, if you listen again, you'll see that the student started with, I'm very, and then cut herself off and changed it to, my friends have told me that I am. It feels a bit defensive. It's just a bit unfair to me because I can't really question what your friends think. And I'm interviewing you, not your friends. I'm interested in why you think you're a strong candidate and not why your friends think you're a strong candidate. I would avoid language like that because it feels like a cop-out. I know you do it so that you don't come across as haughty or boastful, but I think it actually has the opposite impact. In fact, it almost stuns me a bit when I hear a phrase like that, and I don't really get to pay attention to what comes after. So for completeness, here is what she said after.
I've been told by my friends that I'm a very open-minded person, and in the spirit of your guys' like guiding philosophy of Cura Personalis, you should always be attentive towards tailoring your care towards people's physical, spiritual, and mental needs. And that's kind of how I've been as a friend. I've been a very open-minded and a friend that like can really take the time to dig in and dissect your specific issue. So, and be open to like your perspective that even maybe I wouldn't do. So that is one of the reasons I think I would be a good fit for Georgetown. Just my open-mindedness and how that is kind of a guiding backbone of what Cura Personalis is all about. And yeah.
So how do you think this answer landed from my perspective as the interviewer? It's broad and doesn't really hit the mark on answering our mission. Remember, I'm essentially asking you why you'd be a good fit for our medical school. And this answer, again, did not talk about any of your extracurriculars. It did not highlight any part of your journey or any part of our near 1 hour long interview. And so at the end of the interview, it just seemed like a poor way to wrap everything up. If this is the last thing that I remember about the student, I don't have much to report back on. Do you have any questions for me? Every time a pre-med fails to prepare for do you have any questions for me, an angel loses its wings.
Awesome. Okay. So thank you so much for taking all the time to answer my questions. There was a lot there. It's also important for you to get some time to learn more about our program. Do you have any questions for me?
Yes, I do. So you told me that you work in education, the Department of Education in Georgetown. I guess like, has it changed at all over the years, or like what ways has it changed, if so?
Yeah, I mean, education is, I'm very biased, but education is extremely exciting and innovative field.
I'm sure when you started at USC, or maybe when you were in high school, education looked like a bunch of PowerPoint slides that were strung together, and a professor would just talk at you, and it would just talk in one directional, and then they would send you home with some worksheets, and that was how you would learn, right? But learning nowadays is just so much more immersive. It's collaborative. We have real life simulations for our anesthesiology residents where they can come into this mock operating room. There's a mock patient on the table. They can be fully immersed in a real emergency that they might not see until like the actual emergency happens. And that is just a more in-depth, comprehensive way to learn than, for example, if I give you a PowerPoint presentation on a cricothyrotomy, which is like this emergency procedure to open up the airway here that you might do once in your career. Now in a simulation lab, we can do it for every resident, every time, and they can get the reps and they can really feel what it's like to feel the tracheal rings and all these tissue. There's always better ways to teach and convey what we've learned in the past to future generations. And in just my short stay of 10 years here at Georgetown, we've already played with VR and AI and mock simulations, and we're excited for where the rest of education is going to go in the next 20 or 30 years.
So there's been a lot of more technology incorporated into like helping people understand this.
Yeah, and I also think that educators are getting more creative and courageous. There's been a 100, 200-year history of just talking at people, but now we're starting to recognize that maybe we're not the smartest, we're not the best educators when we do that, and it's more of like a peacock trying to flash their wings or flash their feathers and show how much we know, but that's not really the best vehicle for teaching. Teaching is student-led. Teaching is, it starts with what the students' bottlenecks are. It doesn't start with what the professor's research expertise is. And so we're just like realizing and getting out of our own way so that our students can get a little bit better and stronger as learners. So I think it's both a philosophy thing, but also a technology thing that helps us a lot.
Didn't you see how fun this two-way conversation was? This is one of the first times during the interview where the student takes the lead and I'm the one answering the questions. I'm the one energized, passionate, giving real examples, addressing whatever concerns or questions that she has. And this transition from interview one-way street to conversation two-way street does not have to happen at the end of your 1 hour long interview. It could happen from the beginning. I mean, look how excited I am to talk about the cricothyrotomy simulation. This is the point in the interview where you want to get to. You want to spend about half of your time sharing your greatest hits and allowing the other half of the time for the interviewer to meet you halfway. And again, you only get here by taking those opportunities to listen, acknowledge what the other person is saying, reflect on what they are saying, and ask them questions on the things that they bring up. Get to the point in the interview where both of you are active participants. Both of you are trying to convince each other to come to medical school. Georgetown is my top choice. Please accept me.
I don't have any like pressing questions at the moment, but I guess like one thing that I wanted to like insert at some point in this interview is that like Georgetown is like one of my top choice like medical schools. I can really like envision myself here, and I certainly would go if like I was accepted here. I think especially with your guys' guiding philosophy of Cura Personalis and how it applies to my personal and professional experiences also is a guiding reason why I would love to go, and the fact that you guys understand healthcare, medicine, and political advocacy and can kind of wrap that all into a student's medical education is really why I can see myself fitting with your guys' community.
Awesome. Well, thank you for sharing that. It was very nice to meet you.
This is a bit of a controversial move, and I'm not really sure that it matters. I think you need to read the room. And if you had great rapport with your interviewer and you think that they would appreciate a full send love letter just like this, then go for it. But I do think that if you are already at that point, they likely would have advocated for you just as strongly already. Now, if you didn't have a great interview and you still went with this, it would feel desperate. Like a Hail Mary, please accept me, this is my only chance prayer.
But again, if you were in that situation, they probably wouldn't have recommended you anyway. If you felt like your interview was good, but maybe not great or perfect, I do think something like this can make the interview end on these good, bubbly feelings. This interview breakdown is a brand new series, and I want to hear what you think about them. Do you want to see the whole thing uncut, beginning to end? Do you want me to focus more on the mistakes and tell you about the 3 things that all adcoms are looking for? You tell me what you want, and I'll make it. If you like this video, you'll love our application breakdown series. That's here. See you soon.